Polycystic Ovary Syndrome is an underdiagnosed and under-researched health condition that is leading the cause of infertility, and yet it affects up to 13% of women and costs more than $800 million a year. Today, global experts are coming together to release a new international guideline to improve the health of women suffering the condition. Professor Helena Teede from Monash University is the driving force behind the new guideline and joins us now, along with Lorna, who lives with PCOS. Professor, first to you, many might be hearing about PCOS for the first time. What is it?
Look, it's a really confusing condition in terms of the name. First of all, it's not a disease of the ovaries. Secondly, there are no cysts. It's a historical legacy that we have from when we didn't understand the condition properly. But basically, it's a hormonal imbalance where some of the hormones change and it affects your metabolic or diabetes and cardiovascular disease risk. It affects fertility. It has many effects on this hair and skin. And it also has significant psychological impacts.
So cyst and ovary is in the name. Should the change start with the changing of a name?
Yes, that's underway at the moment, but very important that we work with women and health professionals around the world in that process. We've already consulted thousands, and that is well on its way in terms of progress.
Well, Lorna, what's been your experience living with PCOS?
Well, first of all, it's a battle to even get diagnosed. So I was diagnosed probably about 20 years ago now, and that was through my own sort of advocating for myself and going to many different doctors and being shut down along the way and told not to worry about it, those kinds of things. And when you finally do get diagnosed, it's like a piece of missing puzzle, but it continues to be a battle because there's so much misinformation and non-evidence-based information out there in the world, and everybody has an opinion.
Can you talk to us about the symptoms that you experienced?
So for me, it was irregular cycles. My weight has fluctuated throughout my life. I had trouble getting pregnant with my now 26-year-old daughter. I had hair on my face. The weight was a big thing. So, yeah, those irregular cycles, hair on my face, weight fluctuations, trouble managing my weight in spite of eating really well and moving an extreme amount.
Professor, why is this condition so neglected? Why is it hard to get diagnosed?
Look, in part because it's called Polycystic Ovary Syndrome, to be honest, Esmeralda. So it's seen as a women's health condition. There's only about 1 hour of education in a 5-year medical degree about something that affects 1 in 8 women. And the education focuses on the ovaries and the infertility. It's much broader than that.
Lorna, what helped in treating your condition?
Well, there was things that didn't help, first of all, but then I was very good at finding information and tapping into resources. So metformin has helped me a lot. Healthy lifestyle, exercise, all of those sorts of things have helped me immensely. And metformin's really old and relatively inexpensive, very, very cheap and easy to obtain, and we know how it behaves in bodies, so it's not an unknown quantity. So that really helped me a lot. Managing my weight is a big thing, and metformin has helped with that.
So, Helena, releasing this international guidelines, how are you hoping it's going to help both the health sector in diagnosing and patients like Lorna?
Yeah, great. So it was very much done hand in hand with women for women. So the topics we covered, every step of the way, people from around the world were involved. We started with thousands on survey and then met with many focus groups and then had women with the condition involved throughout, and those with PCOS. But the real aim of this is to get really good evidence-based, trustworthy information into the hands of women and their health professionals. And we can't underestimate how adverse the impact on quality of life is. It's significantly worse than diabetes, for example, and it's 50% more common than diabetes, but it's neglected because it's put in this little box of being a special women's health problem, and it just needs to come out of that, come of age, and people need to recognise it's serious and it can be addressed.
All right, thanks so much for coming on Midday and talking us through it, Professor Teede and Lorna. Appreciate your time.
Thank you. Thanks, Rhonda.